everyone, and Happy New Year. It's 2025, and welcome to another edition of Clock Talk with Dr. Greg Brannon. How are you today?
Fantastic. Another year, we're still alive, kicking.
Yeah, I know. 24 was great, and hopefully 25 will continue to be great. Wanted to talk today about the BHRT pellet, which is what Optimal Bio primarily focuses on. And for those that are new to the show, had a little trouble working the clicker. It's 15 minutes per topic.
Clock Talk.
And so today, obviously throughout the last year, the businesses continue to grow. I think some of us internally in the company think everybody in the country understands what the actual pellet is. And in reality, they understand testosterone, I think. Some of them do. But the pellet itself is a totally different animal. So there have been some patients that have been interested in coming in, and they go through the whole process. And before they see a doctor such as yourself for the consult, sometimes they'll cancel. And they have canceling because they've either read or they have talked to their other providers about the risk of the pellet, in this case, testosterone, as reviewing it, increasing the risk of cancer. So before we go down that road, I want to address that in the first 15 minutes. But let's just simply talk about BHRT, bioidentical hormone replacement therapy, so the pellet itself, and why, and testosterone in general, and what some of the differences are.
Yeah, I want to start off with a little story because this happened actually about half hour ago. And this is a story that's constantly, I hear all the time, because part of it is, it's me talking to patients 20 years ago, saying these type of same things. Had a lovely lady is called off and she's confused. She's been on pellets one time. She got placed one time about 5-6 weeks ago. She's a 58-year-old lovely woman. And she's at her gynecologist's office for a follow-up. And she was saying how wonderful she feels. And the doctor goes, it's going to cause cancer. Boom. I have other things for you. The patches, we'll go into more detail. The patches, I have this pill for you. I have this, I have that. And but there's no caveat with those. Here's the problem. Bioidentical hormone replacement therapy, i.e. via the pellet, has no increase in cancer. The synthetic ones that I prescribed for years has an increase in cancer. But the problem is the government puts them all under one umbrella. The thing that's very frustrating, Jim, is this is the 90th year of the pellet. First case was 1935. It was done on women first, not men, by the way, because women make 50 times roughly more testosterone than they do estrogen. People know that. So it's the 90th year, so 1935. This particular pellet, the bioidentical pellet, has never been recalled in any country ever. Now, in 2018, the FDA did a review of pellet therapy. And in their actual 320-page book, it says there's not enough data on this. But also in the book, it says there's been over 18,000 articles over the years, but they only looked at 2,000 of them. That was in their own data. So it's very frustrating, Jim, when we hear these stories on something that truly, we've placed hundreds of, probably, when you look at individuals, how many times we've been placed, we've probably placed 150,000 pellets over the last 10, 12 years. We have a 97% retention. There's a great book I forget that I wrote, another book by Dr. Mark Richards, who was Obama's White House physician. He shows the data on this over and over and over. It's just the opposite. He believes chronic healthcare costs can be decreased by $1 trillion a year if we have optimal hormone levels. So this idea that things cause cancer is very frustrating because they say it because they have the white coat on. They're the expert. I mean, we've written free books on this. It's not like we don't do our research. So that's my frustrating part. You know, these lovely patients are caught in the middle. Who are they going to trust? That's why, if you had to use one word to describe Optimal Bio, we use the word educate. Our job is not to sell anything. Our job is to give information so a patient can make an informed consent. And that's the problem that miss. The cornerstone of ethical medicine is informed consent. So that's a little story we have about that. But a pellet is a compressed, looks like a little grain of rice of pure hormone. Now, there's two things in this pellet. The hormone itself, either testosterone or estradiol, a type of estrogen, but they need a glue. So the glue has to be a fat. And there's two fats that your body makes naturally. One's called stearic acid and one's called cholesterol. I like cholesterol better because the shape mimics the hormones. I have a better stability rate. That's what we use.
So people just don't understand the pellet. So the synthetic pellet has been out there for
about 10, 15 years.
Okay, and that's Testapel.
Now, here's the thing about it. Pharma companies, and again, I'm not anti-pharma. I love it. You worked for, science is great. But the thing is a pharma company cannot own an organic molecule. They can't own it. When they invent a molecule, they have 17 years that they own the patent on it. So I think the onus is on them to tell me that the molecule they make is superior to the one your body makes. I disagree. There's data to show that. But that being said, so an organic molecule, again, cannot be owned. So there's really not as much money in that if you own the patent. So the pellet has been used, the crystalline pellet, for 90 years. Like I said, it's simple. Cholesterol is made in your body. Stearic acid is made in your body, if you either one of those two. And testosterone, estradiol is made in your body. They're your molecules. And these are made with plant-based, but they're identical, meaning that the Mayo Clinic says when the body recognizes same. So your body does not know where that comes from. Testapel has bioidentical testosterone in it, fantastic. They use stearic acid, fantastic. But to make it patentable, they have this disintegrating agent called vinyl polypropionate. Great. So it's an inorganic molecule that makes that one better. There are benefits to that. But the EPA over here says, don't put in contact with skin. But yet the FDA approved it to be within the pellet. And there's been complications of blood clots. So the thing about it is because there's some product to it, but my goal is to get the most benefit with the least risk. And when you delineate the bioidentical versus synthetic, there virtually is no medical risk. Breast cancer is decreased. Dr. Glazer at Ohio, she looked at bioidentical testosterone pellets. She shows in her studies, a 10-year study, Jim, that showed a decrease in breast cancer between 40 and 60%. 40 and 60%. We just blow through like it doesn't matter. Birth control pills with synthetic progestin increases breast cancer between 17 and 30%. But we take birth control like water pills. That's why it's important we look at the data and the science.
When you first started the business, you weren't a believer. We've talked about this in past podcasts.
Far from it, Jim.
But doing your research on the pellet, you probably answered some of this question already, but what are the process? What process did you go through to want to specifically do pellets only in the practice?
My whole goal was to mimic a route or mimic a blood level that's the most close to your gonads, your testicular ovaries. And when you start looking at the data, the only thing that does that, the only thing that mimics that is the pellet, because the way it's made is just compressed. So picture literally a grain of rice. The male pellet is 4 millimeters by 12 millimeters. Women pellets the estrogen pellet is like 0.5 millimeter by a millimeter. So, because we have all different doses based upon the patient's algorithm. But the bottom line is that sticks in the fat. Fat is very vascular. So what an endocrine gland does, an endocrine gland is not like a nerve. A nerve connects from point A to point B and the transmissions through that. An endocrine gland squirts the hormone into the bloodstream and the cells that need it grab it. So that's exactly what the pellet does. It sits in the fat as it dissolves at a very steady state. That's the key, is a steady state. That steady state, now it's available in the blood for the cells to grab it. And oh, by the way, who needs testosterone? Which cells? All of them. So if you have a level, say 20% of 50 years ago, well, you have 20% of the benefit. When your levels are optimized in the cells, the benefits, and the most important cells are the heart and the brain. So it's very important. Again, breast tissues decrease cancer on it. Prostate cancers decrease. So the key is I want to mimic the best. The shot, the most common shot is called an ester. It's whether you have the bioidentical molecule, 17 beta testosterone, bound to this long chain of what's called an ester. There's propionate, which is the first one invented, ethane, and cyprinate. And what does those large chains of molecules of carbons allow it to be hydrophobic, so it can sit in the muscle a long time. So it's there for a long time. It's days. The half-life is for cyprinate, it's 3.5 days. Mm-hmm. So this is the peak and valley. The pellet goes up in 2 days and stays for 4 to 6 months.
Okay. So you're doing this comparison, obviously, at the time, but you're also looking at studies about the benefits of BHRT. Yeah. And were you concerned at the time about this whole cancer thing?
Yeah. The very first time I actually heard about it, I thought to myself, it's going to cause, a friend of mine was on it, said it's going to cause cancer. I just said it because I was trained to say that. Then I started doing the research. I'll go over the prostate cancer first. Prostate cancer, Dr. Huggins and Hodges in 1941, University of Chicago, published a paper that's still quoted today. It says testosterone therapy causes prostate cancer to grow. Huggins won the Nobel Prize, I think, in 66 or 67. We're talking pure scientists. How many men were in that study? 3. 2 dropped out and only 1 stayed. That's the paper that's quoted.
So it's literally a study of one person?
One man who was castrated. So he had no testosterone. Dr. Mordahl, in his great book called Testosterone for Life, he's a professor at Harvard, went back and goes over this, instead of reading that book. The problem was that study was that one person, it was one person with no testosterone. He found that the prostate gland gets saturated around 90. So after 90, it can't make it grow. And he also shows papers. He actually did a paper of 13 men with prostate cancer he gave pellets to. And he rebiopsied him 2.5 years later. 56% had no cancer, 40% had no change. He had another paper, great paper with hundreds of each arm, where men with prostate cancer after treatment were given pellets, no pellets. The ones with no pellets died sooner of recurrence, heart attack, and dementia. Testosterone is the elixir of life. He wrote in his book as a great paragraph. He says, what if a pill did this? And he listed the 50, 60 things it did. He goes, we have it. It's called testosterone. So I just do my research, Jim. I woke up. And then the goal was to mimic the testicle. The cypridate, the cream, the shout. The creams are out of your body in 7 hours. Yeah,
so we'll talk about that a little bit later on. Okay, so you're doing this research.
2 years.
And that's fast forward now. The practice has been around for, 13 years?
March of 12 we started.
Okay. I know we keep a lot of data on our patients. I know we have a 97% retention rate. Mm-hmm. Have you seen a lot of patients getting cancer during the years?
Just the opposite. That's the whole thing. That's all benefit. And breast cancer is about a 1 in 8. 50 years ago, it was 1 in 20. So the first question you ask yourself is, why is it going up? Most of the women who get breast cancer aren't on hormones. In fact, that famous WHA paper came out in 2001. From 1935 to 2001, virtually every paper said there was no increase in breast cancer. And the 2001 WHI paper came out and said, hormones cause breast cancer, stop hormones. First off is, they didn't use estrogen. They used Premarin, which is pregnant female horse urine, and they used E1, which has more prevalence to proliferation. And in the other arm, it was Premarin plus medroxyprogesterone, which is a synthetic progestin. It's very interesting, that study, Jim. In the Premarin-only arm, it did not increase breast cancer. It did not. But it increased cardiovascular events. In the progestin Provera arm, Premarin Provera arm, it increased it by 24%. The next day in the news, hormones cause cancer. But that wasn't bioidentical. So Dr. Fiornero in France did a phenomenal study where he did, very simple, 134,000 women divided in 2 arms. He gave them bioidentical estrogen pellet, progesterone naturally, bioidentical estrogen, and synthetic progestin. The bioidentical arm decreased breast cancer by 10%. It's mimicking a youthful breast. The synthetic arm increased it by 69%. It's the synthetics. But there's a book called Estrogen Matters, phenomenal book that goes through the WHI paper that tore it apart. They skewed even the data on the PremPro. It was an older population who had more chance of breast cancer in the first place. It was a skewed paper. From 2015, I think it was, Hopkins went back and looked at the data, said how many lives were saved by stopping the synthetic. They were saying roughly between 19,000 and 95,000 patients a year died, extra deaths, because by stopping the hormones, it increased dementia, cardiovascular disease. So my goal was, can I get the benefits with minimal risks? Mm-hmm. And when I'm talking risks, I'm talking heart attack, stroke, dementia, cancer. Yes, the risks are, a bioidentical hormone is, to get the dose properly, maybe losing a little bit of hair is reversible. And that's basically it. There's not risk factors that increase cardiovascular events. In fact, at optimized levels, you show that you decrease cardiovascular events by up to 250%. Again, not use my data. Dr. Richard's book goes through all this on the heart. It's fantastic studies.
And I believe you mentioned all these studies you're talking about. They're either in your hormone handbook
And the new book,
or
Restore.
your Restore book.
Yeah, book. The first book, we have about 80 references. In Restore, I have 497 references. I have 82 alone just on breast cancer. The key, Jim, is not my opinion. I don't want my opinion. The first question everybody should ask me personally is your wife on it? First patient. Are you on it? I am. If I was not, then I'm selling something. I'm doing something I believe in, because now that we have this data, again, nobody's forced to come to us. Insurance does not cover this. We've done, again, 150, 200,000 placements, and we have a 97% retention. And we're in 5 states. So it's not like just because they know us. It's going across where we're at. It's the results prove themselves. That's what took my thing, Jim. It took me to actually do the research and make sure it worked for me and my wife. And then I showed it to my patient base.
And the beauty is that you're on it as well.
Oh, yes.
Fantastic. 15 minutes flew by. Another great talk with Dr. Brannon. Thank you.
Thank you very much.